Okay, so today we're going to be talking about the antepartum, intrapartum, postpartum, and newborn stages that incarcerated women in our country and our state go through. When most women picture their birth, they know that they will have support, whether it be family or partner. In this vulnerable state, they hope for a safe, healthy pregnancy and a period of recovery spent with their new baby. For women who are incarcerated, this is not an option for reality. These women at most get one support person and the option for a doula. Sometimes, within hours of giving birth, their babies are taken away into state custody and they may never see them again. Colorado currently houses 1,505 women in correctional facilities, and that's a statistic from December of 2024. According to research done by Johns Hopkins University, 3% of admissions to jail are pregnant women. How do our correctional facilities handle and treat these women? According to the Colorado Department of Corrections, the DOC, and I quote, it is the policy of the Colorado DOC to provide pregnant offenders with medical and social service options related to birth control, pregnancy, child placement, and abortion under specific circumstances. The DOC strives to ensure pregnant offenders receive treatment that promotes their health and safety, end quote. During intake to correctional facilities, it is state policy that any woman under the age of 55 is screened for pregnancy, and any time after intake, it's the offender's responsibility to alert staff of signs and symptoms of pregnancy. Once pregnancy is confirmed, offenders in Colorado will be housed at Denver Women's Correctional Facility, DWCF, to receive prenatal care. From there, it's the responsibility of clinical services to organize a pregnancy plan, arrange for labor and birth at a hospital, newborn placement, and the power of attorney with the pregnant offender. In addition to these preparations, all offenders will be given access to outside guidance regarding newborn placement, whether it be state custody with a family member or an adoption agency. So I'm going to screen share really fast because I want to talk about these documents. So this is from the Colorado Department of Corrections website. Can you guys see what I'm sharing? Okay, so this page, the first one is the offender's right to name a support person and choose a doula and have it documented if they choose to do so. Part 2 of this document is if the offender has certain things that need to be addressed, such as if they're a harm to themselves or others, then this is documented saying that they will approve restraints or not approve restraints, or for SI precautions such as plastic eating utensils. The next form is going to be a form that the offender signs, stating that they understand their rights and responsibilities when going to a facility like that. Along with that form, it is Colorado state law, the pregnant offenders will not be shackled, belly shackled at the hands and wrists or the feet, transferring out of a facility to a hospital during labor and birth, and then transferring back to their facility of corrections, unless they're a harm to themselves or others. The next form that they're going to fill out is going to be a notification to the person who's going to assume care of the newborn. Because this certain facility does not have like a mom baby unit. This form is going to alert the person who's taking care of the baby where the baby's going to be and their rights and responsibilities pertaining to that, as well as power of attorney for whoever is assuming care of the newborn. And then this form right here is basically something that the correctional facility and clinical services has to fill out to alert the county of the offender, whatever county they reside in, which would be Denver County in this case. They have to report to DCFS basically and alert them that an offender in your jurisdiction is having a child and it may warrant an investigation or intervention. And the last form is more administrative for the jail. But basically in Colorado currently, as of 2025, these are the rights of pregnant offenders before they go into labor, and all the legal forms that they have the right to be informed about, as well as fill out for support and guidance through their labor and delivery. And that's all I have for antepartum. Thank you for listening. I'm going to give it over to Jena now.
Okay, so I did intrapartum, so childbirth and labor. Let me just get to my thing real quick so I can read it. Sorry. Okay, so pregnancy is a transformative experience that's often associated with profound care, support, and adequate preparation. Yet for incarcerated women, the experience entails unique challenges and systemic barriers that alter this and create a physical and emotional stress. Um, the National Institutes of Health states that approximately 55,000 pregnant women are incarcerated in a year. And when these women are passing through the criminal justice system, they are provided with inadequate prenatal care. They have limited options for proper nutrition, and they have it takes a psychological toll of their mental health at birth when they're in a correctional environment. This population faces challenges of discrimination and feelings of being judged because they oh, are experiencing this normal human experience in a moment of being incarcerated, which they aren't. Yeah, so the experience of giving birth while incarcerated and is often a traumatic experience marked by inadequate medical support and restricted policies, and it lacks compassionate care. This can be compromising of the patient's health and dignity. This population faces challenges of discrimination and feelings of being judged and not being treated like a human, having a normal human experience, as stated before. Regardless of what they've done and who they are, this population experiences shame from society simply because they are a prisoner. The most concerning practice, in my opinion, is the shackling of inmates during labor and delivery. Despite the unethical dilemma and backlash, these practices are still persistent in correctional and facilities in their labor and delivery environments. Um, the practice of shackling through the labor process limits maternal mobility during labor, and this impedes necessary medical interventions and causes unnecessary psychological stress and pain. The American College of Obstetricians and Gynecologists openly opposes the use of shackling during labor, stating that the restraints interfere with the medical professional's ability to safely practice medicine, especially in emergent cases. Furthermore, increasing the risk of adverse outcomes for both the maternal and fetal health. Um, to put this into a visual perspective, let's say that our patient has hypertensive conditions, and we know that these can lead to eclamptic seizures. And our number one priority in those moments is safety. So restraints in this type of case will cause the patient to suffer from injuries. And shackling also presents restrictions along with maternal and newborn bonding, because after birth, this can increase the risk of harm to the newborn, such as falls, because the mom has limited mobility when holding the baby. Um, or even the mom can fall as well before giving birth. Say she's ambulating, she can fall and have an abdominal injury that could lead to more trauma for herself or the baby. Excuse me. As of December 2020, 2022 or 22 states passed laws prohibiting the use of restraints during labor and delivery process. Although that this is a great progression, there's still the hovering cloud of the past, that these legislations are non-binding in some states. Colorado is one of the 22 states that passed this law. There's not much data that's reported about the criminal justice system regarding pregnant incarcerated women. This information is crucial for us in providing evidence-based practice so that we can continue to advocate for these patients on why the use of restraints during labor can increase complications and injuries. um, because it's not an ethical thing regarding, this is a natural human experience, and um, regardless of who somebody is or what they've done, just because they're a prisoner, they still are having a natural human experience that they need to be treated properly with the proper care as we would anybody else, no matter who they are. So no matter what like I said, the legislations are non-binding, so it's our job to advocate for our patients as nurses if these restraints are still being used um, for our patients. So that's my section, and I'm gonna go ahead and pass it on to Lexi now.
So I'll be talking about postpartum today. And I just wanted to start with having you imagine that you have just given birth. You're in a peaceful, comfortable room, holding your newborn baby against your chest. You're feeling their little heartbeat against yours. You're surrounded by family, friends, loved ones that are offering you support, helping you rest, making sure that all your needs are met. And you have time to heal after this exciting moment, 6 weeks and more to bond with your baby and adjust to this wonderful new chapter of life that's coming. There's a different reality that many incarcerated women experience. They've just given birth, but within hours, maybe even minutes, they're forced to say goodbye. The recovery isn't peaceful, and there are no loved ones to hold your hand, and possibly biggest of all, no certainty of where your child is going. Instead of warmth and support, you're met with cold institutional policies, rigid schedules, and a system that sees you as an inmate before a mother. This is the postpartum experience for many incarcerated mothers. A period of time that is known for healing and bonding is now being marked by separation, poor medical care, and emotional trauma. Today, I would like to talk with you about what that looks like for women in the prison system, the challenges they may face, and the impact it has on mom and baby, and what's being done to change it. Currently, we have 38 states who do not offer any prison nursery programs, meaning they do not allow incarcerated mothers to have any type of bonding time with their newborns. There's no standard policy for what happens when a mother gives birth while incarcerated. And in fact, it wasn't even until the 1990s that mandatory health care for incarcerated women came into effect. As we have all learned, bonding with the newborn has many benefits, whether they be physical, emotional, or developmental. For the baby, allowing time for bonding creates a sense of safety and comfort, thus helping establish a secure attachment. During this time, many mothers will be breastfeeding, which provides the child with essential nutrients, antibodies, and hormones to support the baby's immune system and growth. As for mother, releasing as for the mother, bonding decreases the risk of the mother's risk of getting postpartum depression by releasing mood regulating hormones such as oxytocin, prolactin, and endorphins. These hormones promote relaxation and reduce stress for mom. While the mother is breastfeeding her infant, oxytocin also triggers uterine contractions to help bring the uterus back to its pre-pregnancy size. This prevents the mother from having postpartum complications such as bleeding. 38 states who do not allow this period of time for mom and baby put both the individuals at risk for many medical issues. The infant will experience attachment issues that can lead to the infant to distrust caregivers as they age. They're at higher risk of developing depression, anxiety, behavioral issues. Their cortisol levels will increase, which is going to lead to long-term stress responses like GI issues. And due to the lack of antibodies from mom, the baby will also have a weakened immune system. For mom, she will now be at increased risk of postpartum depression due to the feelings of isolation and disconnection from the baby, or feelings of guilt and helplessness. The mother's lack of breastfeeding now impacts many hormones that can lead to, as I mentioned earlier, bleeding. Can also put the mom at increased risk of breast or ovarian cancer. The mother also may have difficulty developing parenting skills to care for their child upon release from the penitentiary. By not allowing this time, we're causing far-reaching consequences that extend beyond the immediate postpartum period. As time has progressed, we are seeing more states start to recognize the importance of allowing the postpartum period spent with the infant in custody. States like Indiana, Nebraska, New York, and Ohio allow mothers to spend up to 18 months with their newborn child, while other states say it can be from 30 months to 2 years. In 2021, a federal bill was passed that seeks to provide protection for pregnant, postpartum, and breastfeeding women in custody. It ensures that all mothers have access to adequate pre and postnatal care, bans the use of shackles, and provides for the development of policies for breastfeeding and care of the newborns. In 2018, the First Step Act was created, and it requires that the Bureau of Prisons implement policies to ensure humane treatment of pregnant women in custody. In conclusion, the extreme difference between the two realities of postpartum care highlights the critical need for systemic change. A conclusion of a study mentioned that incarcerated pregnant people should be viewed as expectant parents in need of comprehensive health care rather than criminals who forfeited their right to a safe, respectable, and humane childbirth. I believe this shows just how vital it is to stand up for basic human rights because the health of these women is not only in our hands, but the government's hands, and we have to do everything we can to advocate and make a positive change without judgment or bias. And that is my postpartum care. I'm going to go ahead and hand off to Sydney.
Hello, one second. So I did newborn care. So many pregnant women who deliver while incarcerated are separated from their newborns right after delivery. They can be allowed 24 hours and then placed with a relative or in foster care. Obviously, it's devastating for both the mom and the baby. There's a lack of bonding. The baby may grow up with low self-esteem or other emotional problems due to that trauma. Mom can be at a greater risk for postpartum depression because they can't breastfeed the baby if they're not with them, and there's very little skin to skin contact, which is very important after birth for bonding and also other reasons like the baby's blood glucose. There's no other like risk factors for that would be like poor prenatal care and social support. I read Massachusetts is the only state to allow an option where moms can keep their babies up to 24 months in correctional residential programs. There are also prison nursery programs where mom and baby can live together in the correctional facility. However, it's a long process with limited spots, so it's not like guaranteed that they will get that opportunity. The program includes parenting classes, support groups. If the mom has like substance abuse problems, it includes classes on that, and then like a complementary daycare. It's estimated that 2,000 infants are born to incarcerated moms each year. And one second. And also some more things that can happen if the baby is born to an incarcerated mother. They're going to have less successful peer relationships and just difficulty coping with life stressors. So it basically just sets them up like right off the bat and just for a not good outcome of their early life. So that can be psychologically traumatizing, and that's all I had. So that's the end.
I did find some photos that were quite interesting. I'll go ahead and share my screen of like mom baby rooms and what they look like. It's just crazy to see here, like, you expect to come home and maybe you have like a king mattress, fluffy blankets, fuzzy pillows, like body pillows to put between your like legs and stuff to cuddle. Clearly these women are met with the thinnest sheets I've ever seen in my entire life. Um, that crib doesn't even look safe to me. The two front ends are open.
I was gonna say,
All of this just looks uncomfortable. The playground, I mean, your child is spending his first few years of life surrounded by barbed wire, and pavement and one tiny little thing to crawl on. It's just really difficult to look at these photos. Again, we have another one where this crib looks safer, but this still just cannot be comfortable right after you've given birth, and it's so tight of a space. Here we have some wonderful mothers in a nursery playroom, because some people aren't even allowed to go outside still to that point. They're just stuck within these brick walls. Then we have moms taking their babies on walks just through gated prison doors. This is a little baby in the hallway with the security guard behind her. It's heart-wrenching, but impactful. We have a mom with her little baby, and as you can see, like in the background, all of these little clothes. It's like there's not enough space. Everything has to be in one tiny room. And yeah, these are the photos. I just wanted to share those with you guys. I thought they were pretty impactful to see.
I had one more thing I wanted to share. A couple years ago, before nursing school, I started watching somebody through the pandemic on YouTube. Her name is Jessica Kent. She was incarcerated in Arkansas and found out shortly after she was incarcerated for drugs and guns. Shortly after she was incarcerated, she found out she was pregnant. When she was being transported to and from the facility, she was shackled. She was belly chained with her wrist restraints. And she tells her story about her experience giving birth, giving active birth, chained to her hospital bed. And before the day was over, the doctor came to her and said, I think you need a little bit more time with your baby. So I'm going to say that you need to stay here for 24 more hours. Simply because that doctor had it in her heart to give this incarcerated mother more time to spend with her baby, knowing that she didn't have family that was going to come take the baby. That baby was going into foster care. But if anybody who's watching this, I don't know who's going to watch it, but anybody who's interested, look up Jessica Kent on YouTube. It was an incredible story, and she just has a lot of experience advocating for prisoners and especially for mothers in prison. So, unless anybody else has anything to add, I think we're going to wrap it up.
No, but definitely go watch that video because that video is really good. But I'm done. Just
I agree.
I'm also done. Thanks, guys.
Okay, I'm going to end the recording.